So welcome to Fertivision-2017. I'm representing GoDoctor, which is a collaboration platform among the global medical community.
Yes.
And we're the official communication partner, which is why we're doing this video. So how are you liking the event so far?
Oh, it's impressive, I must say.
Explain, please.
So many people, so many joyful people. There is a really enthusiastic atmosphere, and you can see it outside the discussion room, but also inside. Everybody's very attentive and very polite and very giving the impression that this society is a big family of people who have the same strides and the same goals. So it's good to see. It reminds me a little bit of my visit to the Australian Fertility Society meeting a few years ago, showing that there is a big family feeling over there. Yeah.
Okay.
And it's the same I feel here.
And can you tell us a little bit about yourself, which country you're from and what your specialization is?
I'm from Holland, from Tulip country.
Okay.
And my work there is, I'm a gynecologist working in the field of reproductive medicine. And I've devoted much of my career into a very important aspect of infertility, and that is female reproductive aging.
Okay.
So aging of the female means the chances of getting pregnant spontaneously, they go down once you get older. And the big question is why and how. And that's has been much of my research line.
So among your recent research, what would you say is the latest big finding you've had?
The biggest finding is probably that when women age, they see number of follicles go down, and that comes to expression by low number of eggs in IVF, but also in tests that represent these numbers, such as anti-Mullerian hormone. And while numbers go down, you can see it in the AMH levels going down, there is also another process going on, that is that more and more eggs that you ovulate are of lower quality. And the problem is that we always have been thinking that numbers going down, quality going down, and that these two processes are parallel. But now we learn more and more that these processes are really going on much more independently than we would have wished them to be. So the fact that we can look at numbers, like measuring AMH or looking at number of eggs in IVF, it doesn't really say something about the quality of these eggs. So that's a problem. Because how can we warn young women like yourself that they maybe should not first do a career, but first build a family, because their average egg quality is low for the population. And at this moment we cannot pick out those young women who are at risk of getting infertile once they have first made a career, become CEO of a famous firm like GoDoctor, and then start to build a family at age 34 and then don't get pregnant because of a quality problem. So that has been a long story.
Okay.
Have I made myself clear?
Yeah.
Okay.
So what is it about traveling to different countries and going to these international conferences that really helps you as a doctor and as a researcher?
Well, for me as a researcher, it's it's very nice to meet with colleagues, but more important, to meet with people that I do not know and to learn about their way of practicing this work on infertility, how they think, how they do their job. I always try to visit local IVF centers just to see how they work, how they have their department organized, what equipment they use. So I had scheduled for tomorrow a meeting at an IVF center here in Delhi, but then I came across the fact that I have to move to the Taj Mahal tomorrow afternoon, so I won't be able to make it. Yeah, that's a pity.
Have you been to India before?
No, this is the first time.
So what's your impression of the medical community here so far?
Well, the medical community speaks very well English, is very well informed. I think they have very good care, but I would have loved to see such places where they do the care. So I'm impressed by the level, and I could have predicted it, because in the European meetings where many Indian people come, they show this talent already. Yeah, but I haven't seen anything of the country yet.
That's a shame.
Yeah.
And you have to leave, I guess.
And I have to leave. Well, I will see the Taj Mahal, but after that I will return to Holland.
And what are the ways right now that you collaborate with colleagues, say someone you just met? How do you stay in touch? Is it primarily email, or are you on social media much?
Mostly through email.
Mm-hmm.
Yeah.
And what is the potential that you see of a platform like GoDoctor?
Well, I'm not sure. For me personally, I'm hardly doing Facebook. I have a Facebook account. I hardly do LinkedIn. I have a LinkedIn account. I mostly work through email, and I love Twitter.
Oh.
Yeah, Twitter, because I can express my thinking about several subjects to the world. So I'm not sure how well it works. I am involved in a platform that we are building in the Netherlands, where we are focusing specifically on patients.
Okay.
So patients can get to this website and ask questions, and we have a group of doctors who try to answer compelling questions for these patients that they do not address in their own doctor contact. Or sometimes these are patients that have been in a treatment scheme, they didn't get pregnant, they ended up frustrated, they stopped the whole circus, and then still they are left with questions, and they can visit this website just to be able to contemplate and rethink all what happened.
Okay.
So how GoDoctor will help me, I'm not completely sure about it. So we really have to wait and see what.
Are you willing to try it?
Oh yes, I will.
Well then, that's
Yeah.
all that's it.
So we will find out in the end. Yeah.
Is there anything else you want to share?
What can I share? Well, nothing specific.
Are you looking forward to anything tomorrow in the conference? Or you're staying? Or
I will have a lecture tomorrow on this specific topic of ovarian aging, how well we can predict those young girls who shouldn't wait. And it's always nice to lecture, because it gives you energy and people ask questions. It's always good. Yeah.